Community Health Icon.
All right. Now, when you passed those college exams and now became officially okay. Now, your success is actually telling us that there is something that he needs to just correct.
Yeah, let me just drop the
Doc. He became the head of Department of Internal Medicine and Cardiology, but then he also got an opportunity to act as the dean of the faculty. Just tell us, at Medunsa, tell us a bit about that.
He acted as a dean of the faculty of medicine.
Yeah.
But also, providing that role of being head of department in cardiology.
Yeah.
And he became then associate professor.
Yes.
Of medicine.
Yeah.
At that time.
Associate professor of medicine. Yeah. Yes.
That I'm sure the memory will also serve me well, because there was contention around the issue of him being professor, I think.
Yes.
And for a while, I think because of the dynamics, I think, of the institution at that moment.
Yeah.
Being almost like the first black, also head of department.
Yes. In a very specialized field.
Yeah. And I mean, you mentioned the story of the history of, his own expertise and experience.
Yeah.
And having broken grounds.
Yes.
Yet, the issue of professorship.
Yeah.
Also became a little bit of a contention.
Yes.
In terms of him being accepted as
Yeah.
a professor.
Yes.
Full professor.
Yes. So the struggles, continued. The man on merit, the work, he's published a lot of work, he's done a lot of work, but still, because he was an associate professor, at some point you have to become a full professor, right? So, but there were those who were, having an issue with him becoming an editor. What was the issue?
Look, we must also remember that at the time of, there was also political change in the country.
Yes. This is now around the new South Africa.
New South Africa, 94 to 90, I'm sure we can...
Yeah, in the early 90s. Yes.
And I think that there was a great change in the country around issues of leadership, especially among black people.
Yes.
And I think that, obviously doubts and others that actually were in line, being of Caucasian,
yes,
wanted to actually ascend to the throne.
Yes.
To get that kind of although they didn't really have the kind of
the credentials.
Yeah.
Yes.
That our astute professor actually had.
Yes.
And I think those were the issues also of the student struggles.
Yes.
Say that our professors deserve that.
Yes.
We've got our own teachers that deserve to really get a recognition.
Yes.
In the faculties and in the institutions that they actually work in.
Yes.
Are contributing enormously towards the research, contributing enormously towards the upliftment of the standards of education amongst their own students.
Yes.
And they are producing also registrars who are becoming specialists.
Yes. Yes.
So the criteria.
So basically, in the New South Africa, there were still those who, on the basis of their color, still thought, they should be, first in line, compared to this one with a darker hue.
Yeah.
So did, he end up being, like full-time dean, or he just acted as the Prof? Did he get to become now the dean, or he just continued to act?
Look, I remember that he worked closely with a certain Dr. Creel.
Yes.
Oh, yes, Creel.
And,
yes.
Dr. Creel also was in internal medicine
yes.
at the time.
Yes.
And I must say that to the extent that I could see that relationship was actually geared towards making sure that at least Prof gets that level of recognition to the professorship.
Yes.
That he rightfully deserves.
Yes. Yes.
But I still stand to be corrected that the struggle for him to become full professor.
Yeah.
I'm not sure that.
Yes, the details. But the point that I think we're trying to touch on is that it was not smooth sailing. Despite his credentials, it was not smooth sailing. Now, obviously, Prof being the head of internal medicine and cardiology, a lot of people went through his hands, as the head of department there. And I must say that in terms of this very interview we are having, one of the people, who said, we need to capture the story of Prof, the great man, is one of the students who, that went through, his training, mentorship, coaching, and is now a cardiologist in Rustenburg, Dr. Muso, Mukhwera.
Okay.
Yes, he's the one who said, Dr. Fundi, please, there's this great man you need to interview. Now, that just shows you just one person who looked up to Prof, who told himself that I want to be like Prof. He is now a cardiologist, exactly the same, a field that Prof, had excelled in, and up until his retirement. Doc, you want to add something, Dr. Masudu Bele?
Yes.
You want to add something around that?
Around it, exactly. I mean, I think that at the time of his own rise in terms of student cardiologists,
Yes.
that he actually nurtured.
Yeah.
Dr. Martin Mbe
Yes.
becomes
Dr. Martin Mbe is one of the proteges. Prof.
Came out of the hands of Prof.
Yes.
And I dare say that you've got a professor who's heading the Department of Internal Medicine, if I'm not mistaken, in cardiology at Sepako Makaka now.
Yes. And I think Professor Mda as well is one of the products that came through Prof.
Yeah, and I think it is Professor Mda that is the protege as well.
Yes. So I think what we're trying to show that Prof multiplied. We will all remember during the last, after the passing on of, late Winnie Madikizela Mandela, the thing was Mamwini multiplied. So in the context of what we're talking about today in terms of the life of Prof. Mokhobo, he has multiplied. So many became internal medicine or specialist physician because of him. Even more, there's also those who decided, to become cardiologists, and they didn't just decide; they qualified, and he continued to mentor them.
Yes.
Professor Titi also comes to mind.
Yeah, Professor Titi.
I think he's head of department also at Vets.
So he didn't just produce for Medunsa or University of Limpopo or SMU, as we now call it. Other institutions, of benefited from the people who came through Prof's hands.
One of the things that is not mentioned, especially around students who were African and studying in other universities, actually got wind of what Prof's capabilities were.
Yeah.
So on weekends, for instance, or things like that, they would gather themselves
Yeah.
and come and imbibe under the tutelage and the tree of knowledge.
Yes.
That
To come and drink at his well.
Oh, yes.
At the well. So his knowledge was so vast that
He was even sharing it with people who were outside of the institution that had employed him. Yes. And that's selflessness. That is service. Is being aligned to your life purpose.
Oh, yes.
Is understanding that we are here on a mission. And that mission is not about us. That mission is about benefiting other human beings. And so Prof, walked the talk. Many talk the talk, but not necessarily walk the talk. Yes. So let me get back to Prof. So Prof, this person who is making things happen. You have so many mentees, you have got so many that you are coaching, you are inspiring people, and all of that. You are now retired, obviously.
Yeah.
Post Medunsa, after you left Medunsa, what did you go and do? Because I can't imagine somebody like you going to sit at home, when you reached retirement age. Did you go into private practice, or did you then decide to come here? What happened?
I came to Poch Hospital.
You came to Poch Hospital. No, his son Pule is actually correcting that. Please correct us, Pule.
Yeah, when he retired from Medunsa,
Yes.
he went into private practice at Sunny Hill Hospital.
Sunny Hill Hospital.
Oh, yes.
Yes.
He was doing Sunny Hill Hospital, Tembisa Hospital,
Yeah.
and also Voortrekker Hoogte
Oh, yeah.
for the soldiers.
As a
Cardiologist.
So
A specialist.
as a specialist cardiologist, he was at Sunny Hill.
His main office was Sunny Hill Hospital.
Yes, but he was also supporting the Defense Force.
Yeah.
I think the medical side of the Defense Force.
Voortrekker Hoogte.
Yeah. Yes. And also, what is interesting to me, because Tembisa is a secondary kind of hospital, normally people like him are at a tertiary level, So to have a highly qualified person like Prof in Tembisa, that is something that says to me he was also sort of decentralizing this expertise. Something that I also picked up with another icon that I interviewed, Prof. Sam Mokhobo, when he was at UP, having neurosurgery there. He saw that one of the feeder hospitals was Tembisa, and he decided that there needs to be capacitation of Tembisa so that some of the people can be dealt with at that level rather than coming, to HF Foot. So I'm almost seeing similarities here, whereby the skill that you would normally find, in the top hospital was now being, made more accessible through a secondary hospital like Tembisa.
Okay.
So Prof, at Tembisa, you were running a cardiology practice. Outpatients there, and obviously admitting those that need to be admitted and be managed further, or referring them, to higher level those.
They need operations or something like that.
Yes.
Yeah.
Beautiful, Prof. So you can just see, the impact, that Prof has had. Now, Prof, you spent time as this senior person who is creating many like you. You were in private practice, you were assisting our defense force. At what point did you actually retire?
Sorry for the record, it was called Military One Hospital.
Yes, Military One Hospital. So I know Military One is the same place that actually admitted our former president Nelson Mandela.
Yeah.
And can you just talk to me about that part of you being? Did you actually become maybe his physician or cardiologist or something? And you guys can help me with that. Or did you work closely with him or support in any way whilst you were at military hospital?
No, I was far from the
Yes.
area.
Okay. But there's another interesting thing. As we're going through your pictures prior to this interview, we saw a picture of you and Fidel Castro. All right? from Cuba.
Yeah.
I'm interested in that because I also know, having listened, to Dr. Masudubele, that actually you were instrumental in that program of South Africa and Cuba
Yeah.
for the training of medical students. So I just want to understand this relationship or encounter with another great man, Fidel Castro. Can you just tell us a bit, how did you guys meet, and what role you played in ensuring that we've got this program that has ensured that people who would have never become doctors through that partnership, they are now doctors?
Yeah, I don't remember exactly how.
Yes, no, that's fine.
How to go to Cuba.
Yes, but you actually met the man,
Yeah.
and clearly it was part of, facilitating. Pule wants to just add a bit around that matter. Pule, can you, okay, Dr. Masudubele wants to just jog the memory there a bit.
Yeah, so with regard to the stint that he had in Cuba,
Yeah.
it was at the behest and invitation of former President Nelson Mandela,
Yeah,
together with an entourage that was led by Dr. Nkosazana Dlamini-Zuma.
Oh,
yes.
Dr. Nkosazana Dlamini-Zuma at that time was the then Minister of Health.
Yes, this is that first 5 years
Yes.
of the democracy.
Yeah.
Yes.
And he was basically headhunted as being one of the most important people who are key
Yes.
in terms of understanding the dynamics of student admissions and all of those
Yes.
kind of things, having been
An acting dean and the HOD
Yeah.
of a discipline.
Oh, yes.
Yes.
and I think that criterion is bearing its own fruits at
Yes.
the moment, because as you say, that there are students who never have thought that they could actually become doctors.
Yes. And I think,
Program and became doctors.
and let's go back a bit, because remember, the early years of Prof, in the farm, and then also coming to be another farm here in, in outside of Potchefstroom.
Mm.
So he understood that there's so many other people with potential who, for reasons beyond,
Healthcare.
yes, could be given an opportunity.
Mm.
And so actually, when I remember some of the people that are qualified doctors now through that program, they came through difficult circumstances. And now others have gone further to become specialists and super specialists and all of that, which shows that, people just need opportunity and support, So, because when I interviewed the other health icon, Prof. Sam Mokhobo, he did mention the same thing, and for him, he was also saying internal discipline, universities in the country could do more to get more people trained. But he was also saying the number of people from the continent is getting to a point where, it's starting to disadvantage those who are actually homegrown. But for Prof, he was part of getting our people to get, training in Cuba. And Cuba has got the lowest, ratio. Let me put it this way: the doctor-patient ratio in the world. If you compare it with the country, across the seas, which is the US. The US has got all the money, but the health outcomes don't even compare with Cuba. And Cuba has got an excess of doctors. That's why they even send some of their doctors to be in areas where there's epidemics and pandemics, and all of that. So he was tapping into, and it's rooted in primary health care,
Yeah.
the right mindset of public health system.
Mm.
Yes.
That was my almost obsession.
Yes.
Primary healthcare.
Primary health care.
Yeah.
Yes. That's why it was not so difficult for you to transition to Potchefstroom Hospital.
Yeah.
Now, your time here at Potchefstroom Hospital, you continued rendering your specialized care as a cardiologist. We've just been to the hospital. We've seen the adult ICU and the child, children's ICU. We've been to the MOPD, and that room where you actually saw patients. There's room number 1 up to number 5, consulting rooms.
Yeah.
But there was a special one where you were actually seeing the patients. Unfortunately, it was closed when we got there.
Mm-hmm.
Now, just tell us some highlights around the time you've been assisting here at Potchefstroom Hospital in the Northwest.
Except the challenges of teaching both doctors and nurses
Yeah?
and trying to get them to the same level.
Yes.
So the nurse practitioner idea
Yeah.
was an idea I planted.
Yes.
Yeah.
And I understand that at some point you actually revised the curriculum, for nurses. Just tell me a bit about that. And if any of you gentlemen would like to add to that part around his role in yes.
He's one of the pioneers of writing
Yeah.
in editing.
And that was supposed to be for national consumption, to guide, what medicines are absolutely critical to have at what level.
Oh,
So
that's
those are the
what-
things that I think for me stand out in terms of that subject that we're dealing with.
Yes.
Giving
The nursing,
Yeah.
yes. So you were instrumental, Prof, in coming up with the essential drug list. Yes, you were not working alone, but you were one of the brains, in coming up
Yeah.
with that,
Yeah.
which was, remember, prior to 1994, there were so many different departments of health in the homelands, and also within South Africa there was Transvaal Provincial Administration, there was Natal Provincial Administration, there was Cape Provincial Administration, there's the Free State, and all of these had to be merged into one. It stands to reason then that you needed something that is national to give a guidance to all of these people who are now working under a unified, healthcare system in South Africa, and you were instrumental in coming up with that.
This was still primary health care,
Yes,
which could be done by doctors, nurses, and even ordinary people.
yes,
Mm.
yes, Prof. I think that's very important, because when we're looking at the legacy of Prof, because I'm going to ask him a question about looking back. What would he want South Africa, Southern Africa, Africa, to remember him for? I'm going to ask him. I don't want you to answer that, but I'm just planting that seed so that you start to thinking about the things that are, things that you have, you would want people to remember your legacy through. Yes, there's a foundation that is going to be moving on with your legacy. I'm going to ask you that question, but we just want to finish up. Potchefstroom Hospital is just about 100 meters from where we are, and I'm told you would walk all the time, to the hospital and back, which is aligned to that 20 kilometers that you used to walk to school, and another 20 kilometers coming back from school.
Yeah.
So at your advanced age, you were still physically, active, and I'm told even now, you're still able to walk unaided, in and around here, because obviously as a cardiologist, the issue of physical activity,
Yeah.
and also choosing what goes into your mouth, whether it's beverages or actually food, it's quite important.
Yeah.
Yeah. So just before we took a break, Prof asked for his favorite drink. That is from hole number 19. He's a golfer, and it was a bit of wine and some. What was it?
Lime,
Eh?
spike with lime juice.
Yes,
Lime cordial.
Yes, exactly. And we normally see in the magazines that cardiologists are suggesting that a glass of wine per day can actually get certain, health conditions, to be away. He's 91. He still has moderate amounts of, his favorite, drink. Guys, I mean, so, and by the way, from a spiritual or religious point of view, this is the first miracle by Jesus, who converted water into wine. It can't be that bad, but obviously, if you overdo anything, it will always cause problems. So you still do imbibe, moderate amounts, of this beverage. Yes.
Yeah.
All right, Prof. So, are you still with Potchefstroom Hospital, or you've now completely, stopped working?
Completely retired.
Completely retired.
Yeah.
Now, somebody like you, who has done so much, and clearly a workaholic, somebody who likes his brains to be stimulated, on an average day, what do you do?
I do a lot of reading.
Yes. Reading medical work,
Medical work.
or reading
Medical work and history.
medical work and history. Because there's a book I saw there which has got
Impressive.
history. Can you just bring that book? History
But
about almost anything
Yeah.
in the world. There is, I think this book is a book that I need to get myself, and if the cameras are able to actually see it, I've got no shares in the publishers of this book, but this is the book, a short history of nearly everything. It's got illustrations. It's written by Bill Bryson. This is the book that Prof reads from time to time to keep his brain, stimulated.
what is it? That's very
Yes, with a marker, guys. This is another book that I definitely need to be able, to get my hands on, because I think as you get older, you start to appreciate history. You start to appreciate history, and definitely I'm gonna look at this and see if I can get one. So Prof keeps his brain active, through this. He keeps his brain active. Following developments in his own field, because he can still read and comprehend and, make sense of the developments in this space. But also, like I said, he's physically active. And Dr. Masutubele also wants to contribute in terms of that question I asked, what does Prof do on an average day?
Yeah, I mean, on an average day that you would probably surprise him, he's with a book in his hand.
Yes,
Or a journal. that
Yes.
He's reading.
yes.
And,
General in cardiology,
Yeah.
internal medicine,
Yeah.
anything of interest.
He still subscribes. I think he gets, monthly journals.
Yes.
South African medical journals.
Yes,
And I mean, I will tell you now that, he reads every journal that comes his way.
yeah,
And I must say that, I mean, in one of our earlier moments,
Yes.
people used to tell me that, medicine is his wife. And,
medicine is his wife.
yeah.
So it means his wife is competing with this wife called medicine.
Yeah, and then books are novels or books or
Yeah.
anything else is his girlfriend.
Oh,
Yes. So there's the South African Medical Journal, July 2023. Clearly he has read it. He's keeping up.